Malo lava se fo mria nei tai afo.
Malo si fua, malo le tautua, malo fo ngā guanga a te bai. Ia o le tau ni fo ia mau sawa noa e tala noa ai ma se tasi fo mai tonu California. Ai mani el pesilna, tu una oe, ia. Salo fo isa tala noa fo niso matu ni po lo upo sa tau na tu ina oe po tua oe. Ai o le o Josta Tofi e lo na pito Samoa fo pe tele na masani tangata fo ia o le tonga. O te masani lela walon tama tiva tato fi sanga lu ya sola le kalo matele show i le Hawaiian Hati wa kiki. O na anko swe to do tiva mate sa pepe se fata si o la to na founding members o kapena o kedi koe ma tiva mate. Yo tamalana to dua tonga Samoa. O fo ye. Le fa yu na kapena ya soia yo le tadila le tiba o Josta Tofi. Te uma wala telefoni mai ile dua salwa ya tiba o le pesele te mina out mai in salo po le masina le nete. Ya ai o le POC mani ya fo ile tala mani ya si peselna anyway. Fatalo fatu malo le tunu ya vi pele tu tatu filoai. Ile au finga long pa iho ele tua ya malo pa tailo fo ile na guanga tamam kina ma tua ya me se fo ile ba na lai tiro a onga ya mai la to lo fa fonga mai penga fa ilani po te la volta fo te lo pero fa fonga mai ya tato po klami tu sa o tu nei mai na te America ma welo si le pe me lo tupu ile ne via tunu ya me FBI o tato tangata o tau ni o sa no pa au e tala noi mo se tasfo yo fo mai I tono lo alala pa au mo na ai nge tono California. Dr Kimberly Lutu Fuiava. Dr Kimberly Lutu Fuiava se fo mai nei mai no fa longa mal MD pole Doctor of Medicine mal Oceania University of Medicine. Ma no fa longa le Master of Public Health mai le Walden University yam nei ji bo su enga tulang pa forma in University of Hawaii. Sebab ini sudah tu sangat galui susu yang ngabaila au for clinical research. Mai se fo I ngasele o ta woni o suka I por diabetes. Ya pe ono ta ua yo ta malangat fo I Dr Kimberly ile fontana telefo yo DNC por le Democrat National Convention. Yo mo ko sina vando tal noai ta opposition ngata fo I tulanga fa di forma ya tulanga fo I bero FBI yo ta tangata ya mal fontanga le nei batu ya le fa time le patalo fatu I la sunga Dr Kimberly Lutu Fuiava mo fa mani no lo temi nei ta falava doctor
ta lo falava le sunga ya Ken Aiono fa pe foi radio Samoa ta lo fatu I tata tamama tina matuo lo o falongo mai I fo I le nei radio station. Yeah. Wa o nei o Kimberly Lutu Fuiava o au maune I California masi o mato a inga ya masi mafanau. Yeah o kapsai lava mole nei ava noa umpai una tato tala noa a wafo ia nta upolo o tala noa ina I le radio Samoa.
Aro tele Dr Kimberly Lutu Fuiava ina ai anga e tulo e se fasili mo mamalo le tino do pa fonga mai o Dr Kimberly o na matua ya peonga fo I ya fo vali lutu ya wa fa ilan pa pena fo I ma lona tina sa fa no ina fo lungo tato de jo tele la ba de la sa le ngate tulango le malo ya fo isa ve fo ya peonga ya fo ma Lawyer City por le Attorney General I America Samoa ya pa pena fo le tina ya etena unga sa ve o ia fo mai si nurse po se mai tai mai senior I tonu o le LPJ po le fa mai tele I America Samoa ale Kimberly Fuiava ole sa wa ya tu sa malanga ile Dr. ile po ile Democrat National Convention fa ne sa no ile po experience po le po in Fono tanga tele ale ni yetunu.
Yeah. O au e tau whaale le whaasamoa, ia. E whaamagulu atuai I le tatu au whaalongo. E te I share atu te
experience.
Okay. I was one of the delegates for the American Samoa Democratic Party, Leasa Masuiai I Chicago, Illinois, Mole Convention, a Democratic National Convention. O le vaiaso, lea sama vaiasu nei, sa whaiaile, lea whanasanga tele. Ia, o sa amata whanasanga I laso ngafua, tele yo o tangata ale Democratic Party, lea sa awai I lea whanasanga. O aso ta isaki uma sa iai lava le agenda, le master agenda. Ma ese lava ia mo themes. Alea aso, malea aso. So it was from my experience, it was a very positive, inspiring, and empowering convention. It was just a positive environment all around. We had past presidents of the United States, former or actually still Republican members who are committing to vote for Vice President Harris, Governor Walz. And then the highlight was at the end of the week on Thursday was when Madam Vice President Harris accepted her nomination to be the U.S. presidential candidate for the Democrats. So it was a very fun-filled event for me, very historic.
Ara tele e von sigfil marina chunu o le tele officially o te officially for in reference to our Samoan people. I might say for area of my America Samoa for you to lang o le Democrat o la le se sengo tal tunung o le Democrat a oani no la tu tunung afia ta tu tangata Samoa to the United States of America. What the what do you think? The difference between policies that affects our people in terms of medicine, and healthcare, and what are some of the misconceptions and misinformation that are floating around?
Thank you for the question. I mean, this is my baby. Healthcare is what's very important to me. And why I am in a profession in healthcare. So, fun fact, I used to be a Republican. I actually became a Democrat after maybe when Barack Obama was running for president. It wasn't an easy transition for me. I was, the values, the different topics or core values that are usually discussed in the Republican Party, and why typically our folks, the Pacific Islanders, are drawn to the Republican Party is because of the family core values, their emphasis on family. I found out that actually that is a facade. So, I mean, and this is my own personal realization and why I became a Democrat. So in healthcare, if everyone can recall who passed Medicare, Social Security, and all of the different social programs that exist today in the U.S. Are actually Democrats. So when we think about, what healthcare is in American Samoa, it's basically Medicaid. If you go to the hospital at LBJ, the majority of our folks back in the motherland do not have insurance, health insurance.
Mm-hmm.
How is it that folks are able to afford medical care back home? Everyone, if you are eligible, can qualify to get Medicaid. So that's why you only go and you pay like $20 at the hospital, and you get like your services from the hospital. If you come stateside, you need health insurance. And basically, for me, it's very important that people realize how is it that that when you travel, you can't really go to a hospital and get services because you don't have health insurance. Because in American Samoa, you have Medicaid. You're qualified under Medicaid. When you come stateside, you don't have health insurance. You have to get health insurance again. So those are the things that are important to me. Social Security, all the social programs that aid most of our seniors, our youth back home, our hospital back home, Department of Education, our police stations, fire stations. Most of the funding from grants and all of those are from all of these social programs that we benefit from back home on the mainland. Mm-hmm. So why is that important to me? It's very important. You just have to have that realization that when you come stateside, it's not as it's something that you need to have. I also want to say that if you look at the policies and what each party stands for right now, Republicans are trying to cut Social Security, Medicare, Medicaid. On the other side, Democrats want to sort of enhance, improve, and kind of provide more, keep those social programs still for us so that we can provide those services to the public. Those are very important to me.
Mm-hmm. And, but, you know, it's funny. A lot of American Samoans want to vote Republican. And you're saying that Democrat is trying to maintain Social Security, Medicaid, Medicare. Is that what he's saying?
Yes, that's what I'm saying. And if you look right now at the Republican side of the discussion between Social Security, Medicare, and Medicaid, they want to cut down those services. The Democrats want to improve those services or enhance those services. They can say something else when you're talking to them, but most of the time, if you look at the policies, and anyone can Google what the stance is for Republicans versus Democrats on these social programs, and you will find that, yes, historically and still currently, that's their stance. They want to cut down on spending for these social programs and have more of a focus on trying to, provide taxes or tax relief for those in power or are in the higher tax tiers. So it's just not something that would benefit me personally. And I look for others in the public who would be affected if they cut down these social programs, and that's the majority of Americans and American Samoa, because we have a lot of seniors and all of our folks back home are on Medicaid. That's why LBJ is able to function and able to have the services that are provided to the public.
Mm-hmm. You're in California. How do you, lasa ba ay tangat Samoa in terms of health care and health conditions of our people in the United States as a whole? You as a doctor, how do you evaluate? And are we getting better or are we getting more obese?
That's a good question. Yeah, unfortunately, I am not in an area where I see any Samoans at all. I actually have not seen any Samoans in my area, Central Coast California, but I know that people are more versed on their healthcare needs, and healthcare is a big issue in general for us Samoans and Pacific Islanders, because on the data, the American Samoans, not really Samoans, but American Samoans top our obesity chart. So that's just something in general that we should, as a group, try to work on to improve and maybe remove ourselves from that table or from that chart.
Well, thank you so much, Dr. Kimberly Fuiava, for coming on Radio Samoa. I'll just give you a last minute for any final thoughts for our people, and maybe say hello to families out there.
Sure.
Yeah.
My parents, my mom loved Radio Samoa. I think when they were here in Loma Linda with my dad and my sister, Radio Samoa is what she would tune into every single day. She loved listening to stories from back home, both American Samoa, and, our folks out in all over in New Zealand and Australia. And I'm very grateful for the service that you guys do to inform our Pacific Islanders, especially our Samoans, about what's going on in the world. And so I want to thank you all. And hello to anyone who is related to me out there. And thank you again.
For our non-speaking Samoan audience, I was a physician, Dr. Kimberly Lutu Fuiava. Patay Samoa is a tanongal na mali sunga Dr. Kimberly Lutu Fuiava ni tayo ya po isa uposala ya la fu ay nga mga lo sileo ko na ya mo ni time so